our planning committee that we originally started back in July, called it our short-term planning committee, who are on the phone here. In addition to me, Eliav Bach, and Julia Chatnova, our assistant director, Dr. Marcus Oginski is also going to be highlighted, as well as Dr. Ali Levine, who is one of our camp docs and also on our short-term planning committee, will also be joining us. I'm going to just talk for about 3 minutes, a quick overview of the process that we are in the midst of. Julia will speak just for a few minutes about specifics around the camp program, and then we'll really just open up for questions. And between me and Dr. Marcus, Dr. Ali, and Julia, hopefully we'll be able to answer as many questions as possible. We also, and I'll state this from the outset, this is a process. None of us actually know where exactly we're going to be in June. And what we're trying to do is just be as transparent as possible based on the knowledge that and the facts that we have right now. So first of all, take a step back, just in terms of process. Obviously, 2020 was not the summer any of us had hoped for. By the end of the summer, we had put together a planning committee that really that met every 2 weeks. That was made up of, or that is made up, because it's still meeting, of both people from the medical profession, from public health, from the education world, as well as people with knowledge about business and camp. And we have been meeting every 2 weeks since late July to hash out all the different questions about what it would take for us to reopen. Could we reopen safely in 2021? If the answer to that is yes, then what reopening would look like. We had set a goal back in July that by Thanksgiving, we would publish our first operations manual if we had thought that we could reopen safely in 2021, which we decided along a while back that the answer was yes. Now we've moved towards that. The reason we wanted to publish this manual all the way in Thanksgiving, again, acknowledging that we do not know where we're going to be in June, is that we believe deeply that we need to be transparent as possible and to get buy-in from all of our stakeholders, including our parents, our campers, our staff, our donors, the public health officials who are ultimately the ones who we're going to have to also answer to. The other thing is that when we look at scenario planning, and this is something that we've been doing anytime you run a wilderness camp, you're always thinking about risks and assessing risks. One of the things that we were doing was just, we need to begin planning for different scenarios. We know how to plan how to open a camp when you don't really have to worry about communicable diseases in any major way. We've actually been running a camp like that for many years, but we have never run a camp in the midst of a global pandemic and in the midst of a global pandemic. So our hope was that through this process also that we would be able to create different scenarios and have answers for whichever those scenarios arise. And again, that's where we are right now with draft number 1. Moving forward, the other thing, and this is all written in the draft, but I'll just emphasize, is that we are basing our assumptions today, end of November, on five principal assumptions. One is that, again, we will continue to believe that we can operate safely. 2, that regulators will allow us to operate. We, Ramah and the Rockies, are a childcare facility. We are licensed by Jefferson County, Colorado, and also obviously we have to adhere to Colorado licensure, as well as American Camping Association, National Ramah Commission, and a few other fun organizations. Number 3 assumption is that vaccines will not be widely available for children. We do not make any assumptions about vaccines being available for staff, although we're kind of assuming that they're not going to be fully deployable for staff, but it doesn't really affect our protocols one way or the other. And we're assuming that COVID-19 will still be present in our communities and potentially even at camp. And the last assumption is that testing will be readily available for families in their home communities, and also that we at camp will be able to have safe, reliable, and God willing, also affordable tests. So with that, and just one more thing about process where we are is we expect that, based on comments that we got a ton of comments in the forum. So thank you for everybody who filled that out. People emailed, called us. We assume tonight we're going to get a lot more comments. We will bring this back to our short-term planning committee. And the hope is that almost every month, we will officially release our latest draft. We'll be holding town halls like this every 4 to 6 weeks-ish as needed. And that we're not going to come up with our final set in stone plan until the very late spring when we are getting ready to open. So with that, I'm going to turn it over to Julia, who's going to answer some of the most commonly asked questions on the plans thus far.
So I'm going to have Matt actually put up some slides that we've prepared just with some of our commonly asked questions. It's so wonderful to see everyone here and see so many familiar faces and new faces as well. We got a bunch of questions, and I think they can be sort of categorized into oh, Matt, Matt, the slides are in our Canva. You should have gotten a link. Thank you. So I'll start talking and Matt will get the slides up eventually, and we'll also share these at the end or via email to those who registered as well. But fell into sort of 3 major categories. One would be transportation, the second testing, and the third really our cohorting and the general structure of our program. So in terms of transportation, we got a lot of questions about HEA and airport, so I'll address those directly. With the airport, which we know is a way a lot of you are planning to come to camp, and I see a lot of you on this call are from outside of Colorado. We are not, as a camp, going to require a 14-day in-state quarantine, meaning you don't have to come to Colorado 14 days before camp begins in order to qualify to come to Ramah in the Rockies. I don't know what Colorado regulation will be by the time we get to the summer, but we are not requiring you to come to camp 14 days prior to come to Colorado 14 days prior to coming to camp. So I want to make sure that that's clear. I know that for many families that was a concern if your child is in virtual or in-person school, or whatever your family situation may be pre-camp. Our staff will be arriving 14 days before campers arrive, and they will be doing their own quarantine at camp. Here we go, Matt, thank you. So in terms of airport arrival, we are changing our airport procedures a little bit. So we are asking that families fly into Denver on specific Southwest flights if you would like us to help your child with collecting luggage and getting to our gathering point. We've changed our gathering point. For those of you who are longtime camp families, you'll know we meet at baggage claim 10. This year, we're planning to meet in the Westin Hotel Promenade, which is basically an area for those of you who haven't been to Denver, to our airport. In between, it's an outside area that's covered, but outside. And that will allow us to gather in a space with some airflow better than the airport. So if you would like your child to be met at their gate by a camp staff member, we're going to be sharing a list in February of those specific Southwest flights. They'll be from all of our major cities that we have campers, a significant number of campers from, and they'll usually be the first direct flight of the day from that location on Southwest. Campers are absolutely welcome to arrive on any other flight as long as it lands before noon, just like in previous years. But these campers, we're going to ask that they claim their bags independently and get themselves to that meeting spot. Obviously, we'll be asking you for your campers' flight information and be on the lookout for campers as we expect that they would arrive. But to keep our staff outside of the airport as much as possible, we're limiting the meetings to those specific flights, which again, we'll be releasing that list in February. In terms of departure, again, similarly, we're going to be asking to limit to Southwest flights. We chose Southwest because they have the largest, I believe, number of nonstop flights into Denver, and they have excellent unaccompanied minor policies. And so again, we'll be escorting all the way through, checking in, escorting through security to the gate, any campers who are on flights departing within this window, 10 a.m. to 2. But if your camper's on another flight, it's still okay. They just need to be older or able to check themselves in, or if you want to come meet them in Denver. We know some families like in previous years, but especially this year, might choose to fly into Denver with their camper, options like that. So that's the airport piece. The other big change that we've made this year is that there will be no HEA shuttle on arrival day. This is just to reduce mixing in that shuttle. And so we'll be in touch with you if you selected this option, to make alternate arrangements, to decide what to do with those funds, to switch you either to driving to camp or meeting us at the airport. Local families are always welcome to meet us at the airport if driving all the way up to camp is not feasible for you. There will be an HEA shuttle on departure day. So we will be returning campers to HEA, and that will arrive to the HEA around 10 a.m. So again, no shuttle up to camp from HEA, but yes, a shuttle back down. And then lastly, the change for driving families is just that we're going to have some limitations on how much you can be around camp. So for arrival, we're asking that you sort of just drop off and say goodbye and leave. For picking your camper up after camp, you'll be welcome to take a camp tour, staying out of buildings. We'll be designating a bathroom for you, touring camp with a face covering at the end of camp, but not doing that on the arrival. And we won't be serving lunch to visitors as we have in previous years. So that sort of sums up the major questions that we got around transportation, really just to clarify these policies. And again, these are all written down, and we'll also be revising our transportation quick facts document that we upload to CampMinder. So you'll have that all. You don't need to make any decisions, especially if you're a Denver family, don't need to make any decisions yet. We're happy to work with you throughout the spring to figure out which transportation option is best for your family. We'll go on to the next slide. So we did get a bunch of questions just clarifying our testing procedures and requests and some suggestions for additional testing measures. So pre-camp, we are asking that all campers and staff will show a proof of a negative PCR test for a sample that was taken no more than 72 hours before arrival. If there are further questions about the testing procedure and why we're doing that, I'm gonna eventually hand it over to Dr. Marcus and Dr. Alley. And then we do plan to again test within the first few days after arrival. Again, our medical team will clarify as we get closer to the summer based on the science and the tests when that will be. And staff will be retested with part of our new camper cohort. So we're really seeing when a new group of campers arrive, we're really testing the whole population as well. And then lastly, we are looking into additional tools for community testing, more rapid tests, if that science improves, if those tests improve. We had some suggestions about pooled testing that we're seeing on some college campuses. Again, also looking into that. So that would be like testing all of the samples from an OHEL together. And lastly, we're fortunate to have Dr. Wendy Bernays on our panel, who's pioneering the wastewater testing and involved in the wastewater testing. So we are looking into that, to testing our wastewater to monitor COVID-19 within our population. So those are the pieces about testing. And then lastly, we did get some questions around cohorts and program, specifically about our CIT program. And Matt, you can pull down the slides if you want. And what that will look like in terms of Chugim and Jolie being allowed to be involved with younger campers. Our hope is really that we'll need to maintain very strict cohorting and pods within the first 2 weeks of camp, and that though we will not drop all of our precautions and all of our distancing guidelines, that we will be able to have more interaction as a whole camp community within the second 2 weeks. So that for something like our CIT program, our Jolie hopefully would be allowed to interact, potentially still masked and things like that, but allowed to interact with younger campers, go on Masa with younger campers, things like that. I'm happy to address more specific cohort questions as we go through. And really what we're going to do now is just open it up for questions. We're going to encourage you to actually put your questions in the chat. Matt is monitoring in the chat, and you're welcome to put questions there. If you'd prefer to express your question vocally, you can do that as well, but I think it'll be easier for us to keep track of all the questions if you put them in the chat. So we'll go ahead and give it a moment to put in any questions, and then we'll get started.
We're going to have a couple questions on testing here. Either Dr. Marcus or Dr. Alley, can one of you take anything you want to share about testing, both where we are right now and where potentially we might be in 5-6 months from now?
Yeah, so testing is a big evolving paradigm right now. The simply the best test that's available out there right now is a PCR based test. There are a number of other tests out there. For example, if you pass through a number of airports these days, there's a testing station in the airport where you can get a rapid test done. One of the things about those tests is that they are fast. They are accurate when people have symptoms, which means you probably know you have it already and you don't need the test. But also they tend to create a higher degree of false positives. And so one of the fears with using a strategy like that is that you go and get a rapid test, it turns up positive, and now you can't come to camp. So the negatives are very reliable, but the positives can be false. So at the moment, PCR is probably the best way to go. That's going to depend on where our testing volume is right now. The PCR test takes 2 hours to run. That's how long it takes to get a result back on a PCR test. It takes 72 hours because of such a backlog in the system. And it's going even longer these days, out to 5 days, because there's such an active degree of COVID in the country right now. So I think as we get closer to summer, as we get into spring, we'll know what the trajectory is on that. And we'll also know if there's anything better out there that we can recommend people get to. To a certain extent, we'll probably have a list of options because some of them might depend on what's available locally. If you've got a university campus near where you are and they're turning tests around quick, great. That's where you should go. And if LabCorp with a 5-day turnaround is the only thing you have access to, then that's just something we have to plan
on. Okay, thank you. Just staying on the testing thing for a minute. Well, let me first speak about cohorting, and then cohorting and what we do with a positive. So in terms of cohorting, our plan right now is that we're going to be treating bunks as basically a family unit. So if you have 2 children who flew together from Connecticut to camp, and they happen to be siblings, once they get to camp, they cannot be, during those first 14 days, unmasked together inside, unless they are in the same bunk. So the kids that are living in a bunk are basically a family unit. The question is, and I actually don't have the answer to this, and I throw it over to Dr. Marcus or Dr. Ali, is if on day 3, we discover that in one bunk, in bunk number 5, there is a child who tested positive, but is asymptomatic. What happens to all of those kids in bunk number 5 now?
So I'll answer that question. This is actually the reason why, one of the main reasons why we didn't run camp last summer, is because if we had a positive test on the property, pretty much the county would just come and shut the camp down for the whole summer. What if we have good protocols in place, and if we have good cohorting of campers, then what we can do when we have a positive is that we can isolate the contacts for that positive child or positive staff member, and the rest of the camp can continue to operate. But that's one of the main reasons why having strict cohorting and family units with intense and maintaining all of those pieces is really critical, because if we have a case or 2, we can easily isolate and quarantine and move on and have a perfectly happy summer. But if there's not good boundaries and the county comes and sees that the boundaries aren't solid, then that could be the end of the summer for the camp.
So I guess on that same question, we had some questions coming up here about what happens if there is either an outbreak, and also how would we do we differentiate between positive tests, asymptomatic, and positive tests with symptoms for kids. I don't know if Dr. Al, if you want to jump in here also.
I think in our plans that we would not differentiate between an asymptomatic positive and a symptomatic positive, that person would be isolated immediately, even from their contacts. So that would be separate isolation from the rest of the OHEL contacts and the person who was tested positive, regardless of symptoms. That was my understanding.
Okay, and then one last one on the testing piece of it. Hold on, so I'm trying to scroll through these all at the same time. Financial cost of tests, I'll just mention there, before camp, everybody's on their own. Our hope is at camp we will be able to cover it. That is, yeah, I guess what we don't have, and I'm curious about, is like finding out in real time. What would be, we don't have, to be clear, we have not set every single detail of the protocol, right? Like what we sent out was our first draft. I'll throw it out there to the doctors on the committee right now in real time. What would we be doing? At what point would we want a positive case to leave our ranch?
Well, the camp facility doesn't have much in the ability to take care of a symptomatically sick person with COVID. There's a lot of different options for that would probably be better for that person, and just in terms of comfort, to be treated elsewhere. There's really no intention that our camp property could potentially handle treatment of a bunch of COVID cases. I doubt even the county would even allow us to do that. But the issue of asymptomatic in kids is huge, because for all the kids that'll be on property, the level of symptoms in that age group is very, very minor in a lot of cases. And so there might be that opportunity to, do somebody's quarantine at camp. And when they're done with that, then they rejoin their tents and everything goes on.
Thank you. Julia, do you want to talk just for a moment about how we're approaching both those first 14 days, like what a kid's doing, because we're not just sitting around meditating, for those who are wondering whether camp is still going to be happening, and what we're doing about sessions and kids coming in and out.
Yeah, and I did also see a question about if we needed to quarantine a camper, what would that look like? So I'll try to address that from the program perspective, which I guess I'll address first, which is that I think this year, and we have heard feedback about this in the past about other situations that would land a kid in the mirpa. We are really putting a lot of thought and effort and hiring into thinking about the experience of campers who need to be isolated from the community, in terms of activities, in terms of check-ins, in terms of opportunities to say hello to their bunkmates from their isolation situation. So that is definitely something we're thinking about. I can't tell you exactly what that will look like, but know that it is something on our minds as we think about what the activities, that it will not just be sitting alone in a bed in a room in the mirpa, that there will be activities available and program available if we, through our medical committee, decide that it's okay to isolate a camper up at camp. In terms of sessions and activities and all those questions, I'll address sessions first and then activities second. I did see a question about 2 week versus 4 weeks. So in our 4 week program, I'll say this, if you are coming for 2 weeks, you should expect that most of your time will be spent within your bunk, not physically within your bunk, but doing activities with your bunk. So rotating through our pu'ulot, rotating through our activities with your bunk, which has always been the case for our younger campers, doing evening program, a lot of the normal camp activities. But we will see less in the first 2 weeks, or as a 2 week camper in general, of camp-wide activities. Our hope is that the second 2 weeks of a 4 week session, so for our 4 weekers, there will be some activities that can resume some sense of normal program, or the ways in which we gather as a whole community, or activities that require more gathering as a whole community within those second 2 weeks. So I'd say, this camp experience is not going to be what it was in 2019. It's not going to be our camp experience from 2022 either. God willing, COVID will for sure be done by then. But for both 2 and 4 weeks, we're working to create an exceptional program. If your child is excited about those big camp-wide things, 4 weeks is definitely a better bet in terms of our capacity to do some of those things. But nothing is certain. We can assure you that within both 2 and 4 weeks, kids will have an opportunity to create amazing, meaningful connections within their OHEL, with their madrichim, their counselors, with their co-bunkmates, doing our activities. And I will say there will be, if you're concerned about a camper interacting with their sibling, that will likely, who is not the same age as them or the same gender as them, that will likely not happen unless we are in that 4-week session. So I'll say that there. In terms of activities, we are anticipating that we can run all of our normal chugim per normal, basically. I'll say with one exception, which is our horseback riding program. We are anticipating scaling it down a little bit. So campers should expect to do trail rides and have an opportunity to interact with the horses. We won't have the same level of horseback riding instruction we have had in previous years, but biking, climbing, archery, Zumba, maybe outdoor cooking is out this year. I know that that's a favorite, but all of those normal, like our really core activities we are anticipating doing. We have the advantage of being outdoors. Specialists will need to be masked and distant as much as possible from campers because we don't anticipate them being parts of pods, but we are planning and hiring and operating to run all of our core activities. On our Masa'ot, we are also planning to run Masa'ot. We are anticipating that within the first 2 weeks of a session, that Masa will be with your OHEL or with your pod. I saw a question also about Jolie. With your and shorter and closer to camp, that when we're in that 2-week period, really maintaining proximity to camp and staying within that cohort from your OHEL. The second 2 weeks of the session, we're anticipating going back to our general Masa'ot. We have made the decision already to eliminate any Masa'ot that work with outfitters. So we will not be going whitewater rafting, whitewater kayaking, or to our farm this year, just to eliminate outside interactions as much as possible. But we will be offering backpacking Masa, hopefully in Rocky Mountain National Park. We'll hopefully be offering biking and climbing and all of those things that folks love from our Masa program. I mentioned Jolie really quick, and I think, Elliot, we've gotten a couple of questions about Jolie, so maybe we'll set up a separate conversation with our Jolie 2021 Chalutzim, but around how co-ed will the program be, what will CIT look like, and I'll say in terms of Jolie, we want to work with you. You guys are our oldest Chalutzim, you're really role models in our community, and we want to hear from you what would make your Jolie experience the best that it can be. We hope to continue to include wilderness first aid and all the sort of hardcore wilderness skills, and also the CIT aspect as well. And I just saw from Teddy, we're really excited that a bunch of folks who were signed up for Jolie 2020 are signed up for Jolie 2021 as well, and also a ton registered for seminar. So excited about that. And Jolie, we will follow up with you to talk a little bit more about our program for Jolie specifically.
I want to, Julie, I know this was supposed to be open, but I'll give you a break for a moment. Just in terms of before camp, we are going to be, we've gotten some questions both here and before, is what does it mean to quarantine at home? It is, I believe, it is not we are not asking anybody to medically quarantine at home before coming to camp. What we are asking for is, first of all, everybody understand we're all in this together. We are asking, begging, pleading that during the 14 days before coming to camp, you are extra strict about only being unmasked with your immediate family members in your home. If you are outside, you need to be masked. Can you go to school? If you're going to a school where everybody's wearing masks, then absolutely. If you're going to a school where, you know, that's not happening, we need to talk, because it probably wouldn't work. Can you go to your grandparents' house? Can you meet all your cousins and uncles and aunts unmasked? We would say no. Obviously, this is done on the honors code. We're not going to be, calling or surveilling everybody. But the hope is that for the 14 days before camp, everybody becomes super duper strict about really making sure they are masked, practicing 3 NPIs, mask, social distancing, outdoors as much as possible, and washing hands a ton. Which also brings us to how we expect certainly the first 2 weeks to be running. While yes, you can be unmasked in your own bunk, again, as a family unit, we're not saying you're not allowed to see other people. Of course, we're part of a camp community. As long as we're outdoors, we're masked, we're socially distanced, you'll be able to see and hang out and play with everybody. How do meals work? Julie, you want to take the meals?
I actually think Dr. Marcus is going to take the meal question.
Sure. So this was a fun topic we were actually just talking about at the National Ramah meeting yesterday. The way we'll do meals is that it actually won't be too terribly different than usual, because the way we normally do meals is we have each ohel is sitting at one single table. Remember, think of your ohel as a family unit. So this is like one family sitting around a table. Think of it at like a restaurant. So one family sitting around a table at a restaurant. Somebody else could be sitting at a table nearby you, as long as that table is far enough away. So we're going to be increasing the spacing between our tables in the Chayr Ochel, which, depending on how much enrollment we have, could mean that we simply spread out the space and utilize the whole space. Potentially we overflow to just outside the doors. We have some amazing new facilities that are hopefully going to be done by summer, which will allow us to expand our eating space quite a bit. So we're hoping to be able to simply spread out the tables, have more space in between them, and the service of meals will be different. And we've done this before when we've had other outbreaks at camp, where we don't have any kind of buffet service. So there's not milling of people around in the Cheder Ochel. There'll be essentially table service of food. And when you're sitting at your table eating, you can be unmasked just like you are at a restaurant nowadays. But anytime you're up and moving around or entering and exiting the building, then people would be masked and socially distanced.
And Dr. Marcus may mention this, but we are prepared to take over. First of all, we can go up to right now. We have a brand new indoor Chadar Ochel for that's winterized. During the summer, it's actually going to be a staff lounge. So that's like ready to go. So if we need to, we can spread onto that area. For those who have been to camp, we also have the Omanut, the art pavilion outside, that we might also be using as well. So we're going to be figuring this. We're going to be figuring this all out. We did have a question about the 2-week and 4-week. It is possible that 2-week campers will begin with 4-week campers. There are a few age groups where we might combine 2 and 4 weeks for the first 2 weeks. Our 3rd, 4th graders, big question, Elon note, whether or not we will allow in, whether we will mix our 2-week and 4-week for the second 2 weeks of a 4-week session. I'm putting that in a question mark. Other than those Elon note kids, we do not plan to integrate any new 2-week kids into an existing 4-week cabin.
And we did also get a question about reducing sessions. So we did announce a few weeks back that we had removed the 2B option. So you cannot arrive August, I believe it's 4th, but otherwise we have maintained our current sessions. So we have not reduced sessions. And I think we'll probably get this question as well, since Dr. Marcus mentioned enrollment, that right now we are planning to enroll to our capacity, to our normal camp goals. With the hope and assumption that we will be able to operate at that capacity, and we're blessed with the capacity. Lots of said things about capacity. We're blessed with the ability to add extra bunk space relatively easily, since we do sleep in tents and not full-blown cabins.
I want to answer the question about who supervises a child, not a staff member, who needs to leave the ranch to go to the hospital for a medical reason. I will, and Dr. Al, I'm also going to ask you to comment on this at the end. So unfortunately, over the years, we've had people who need to be admitted to the hospital for all minors for all sorts of reasons. Our practice is always that we are in charge of that child until an actual, custodial parent arrives. Sometimes it happens in 24, 48 hours, and sometimes it doesn't happen at all because the child actually is released and comes back to camp. So if we have a child who, whether they are symptomatic with COVID to the extent they need to be admitted to a hospital, or they break a shoulder and need to have emergency surgery, we really see ourselves as the parental, forgetting my Latin here, parental locus, something like that. And usually we will have a staff member, usually an older staff member. Ideally, a staff member also has experience acting as an actual parent who is there to advocate. We always have a policy that anytime the doctor or nurse speaks with the child, that we have the parent there on speakerphone in case the parent wants to, give direction. This is like the same thing we do if there's a kid who has stitches or something like that. So if a child was admitted to, God forbid, to the hospital for COVID, we would stay there and really advocate for that, for that child. If the parent is from out of state, we would, if the child is going to be there for a while, would ask the parent to come out and take over for our staff member, but we will be there as long as we need to, as long as we need to be. Like, we will not leave a child unattended in a hospital. What I don't know the answer to, and Dr. Al, if you can address this, is in such a situation, like at your doc Children's, in such a situation, can our counselors actually be in the room with them? That's sort of question number one, or how that actually works when you have a child who is hospitalized with COVID. And two is, what happens if a child is symptomatic but not needing to be hospitalized? Is there sort of a step down within the children's network, or is that one of the things we need to figure out, because we can't keep them in?
Yeah. So for the first question, at this point, and everything could change, but at this point, any admitted child to Children's Hospital can have 2 guardians there with them at all times, and those 2 people cannot change throughout the admission. So if a staff member, and I haven't dealt with this as far as like a staff member being with a kid, but say one of our staff members were there, then the parent shows up. At this point, we're not allowing 2 parents to come and switch for the staff member. It should be 2 guardians that don't change throughout the whole admission. So if our staff member leaves and 1 parent comes, that's fine. At this point, it would be a special thing to be able to have the staff member leave and 2 parents come. But yes, I assume that the hospital would consider whatever adult guardian to be with the child at that time to be a person that could be with them at all times in the hospital. The second question about some sort of step down for kids who don't require hospitalization, we don't have anything like that, because that should be your home, right? And so that's a question that I think all group living settings are dealing with right now, that I think for us, as far as the planning committee, we haven't really answered what happens at that point. Because right now, as far as the medical system, we don't have anything between home and hospital.
And I'll just say, for our planning committee, and I see many of you on here, for staff from out of state as well, it's going to be one of the questions I think the county is going to require of us as well, a symptomatic staff member who, cannot stay in isolated camp, but actually their home is out of state. What exactly happens to that? We did hear one camp, I'm not saying we're doing this, but there was a camp that this summer, I know, actually rented a house for staff to congregate in that sort of situation. Skip ahead, it did not work out very well, because not just the symptomatic people, but the asymptomatic and non-COVID people went there too to hang out, had a very bad ending. So that is something that we'll need to think about in our protocols.
We got a clarifying question about session, so I'm going to jump back to that if that's okay with you, Eliav. Clarifying a 2-weeker seeing a 4-weeker, specifically in session 2. So the idea is that if you are a 2-week camper in 2A and you are friends with a 4-week camper who is 2AB, you will be in different bunks, which means that you will not be allowed to interact with each other unless you are masked, outside, and distant. So that means, a game, I don't know what game would work, but, hanging out, chatting, playing outside, ping pong would work great. Assuming Dr. Mark's okay with the contact on that ball, but, and Allie, but you can play, you can chat during free time, you can talk about a book you're both reading, you can do all those things that do not require being close together. We're not going to be playing Jungle Speed with someone who's outside of our bunk. I know Jungle Speed is really popular. We're probably not going to be playing Gaga with folks outside of our bunk. But hanging out, chatting, saying hello, checking in is totally okay, as long as you are both masked and outside and distant. And we know that this will take a tremendous amount of both community and kid buy-in and also staff buy-in as well, to really make sure that that's being enforced. You will not be able to go into your friend's bunk if you're a 2-weeker and they're a 4-weeker and you're in separate bunks, or even if you're both 4-weekers and in different bunks. Like I said, you probably won't be playing Gaga together, things like that, but you absolutely will be able to have interaction and face-to-face interaction, which I know we're all craving. It just will have those NPIs in place.
Question that we had before that Marcus, if you can take, is on day 5, if everybody's arrived with a negative PCR and we are tested and have our results back, that everything is negative, can we all rip off our masks and yell and sing together in the Chadar Ochel around one big table?
So unfortunately not. And the reason isn't that we didn't do a good job of making sure that everybody was negative. It's really not about that. It's more about the fact that if then after that we have a positive case, then it's hard for public health to come up there and say, we can't track the exposures, there's too many people exposed, and that they'll want to shut down the whole camp at that point. If we maintain a degree of cohorting, then that allows us to continue to isolate things as we go along. The first period of time when we're establishing the kind of bubble of camp, then that things have to be very strict in that time period. And then we can ease up on interactions. We can ease up on the number of cohorts that can interact. But there won't be a period of time, I don't think, unless the disease is very, very, very not prevalent by the time we get to next summer, which is possible. But the most likely scenario is that we'll still have a degree of mask wearing, of cohorted interactions. But one of the things I want people to take away with is that Ramah camp is like the ideal place to not get COVID. I mean, the recommendations right now are to do things outdoors. There's almost nothing that we don't do outdoors. I mean, you can open up the windows of the Chadar Ochel and you're basically outdoors already. I mean, so there's a lot of what we normally do up at camp that is going to be totally safe and fine because we're in the great outdoors.
Thank you. We got a lot of questions about types of masks, materials, gloves, things like that. I'll just say in general, way too early to know. You know, we put in the protocols and really was see it as filler words. Anybody going, like when we send people to the hospital or to run errands, they'll be wearing face shields, you know, N95, K95 masks. Yes, maybe that'll be exactly what it is. Maybe maybe it won't be. Those are all the sorts of minutia of protocol that we will be deciding much, much later in the spring. We put that in there because we are aware that, and to Dr. Marcus's point, we can say we're going to be running a camp in a bubble, and I think 98% of what we do is going to be a bubble. But the reality is that we're going to need a plumber at some point. Somebody is going to clog a toilet, even if we beg people don't flush, certain things down. We're going to need that plumber to come up. We're not going to tell them to quarantine for 14 days beforehand. The electric company, is going to come up, et cetera, et cetera. And there's going to be somebody who needs to get a prescription from or get a new set of eyeglasses. So it is going to be porous. And the point is that we're aware that it's going to be porous, and we're going to be making sure that when we send people out, they're doing it in a intentional, extra safe kind of way. I will say to campers here, typically we provide, and we will again be providing all helmets and bike gloves and stuff like that. But if there was ever a year that you would be totally welcome to bring your own biking helmet, riding helmet, biking gloves, it would be this year, because there obviously will have to be an extra level of sanitizing that happens for all of those extremely high touch things. And again, we have not developed right now the protocol to how exactly we're going to be sanitizing each and every bike handle, each and every helmet, other than to acknowledge the fact that we're going to have to figure something out with that. Same thing, by the way, with tents, with our camping, with our camping equipment. We're not at that level of detail right now.
I know also we got a question on this topic of how many masks am I going to need to bring? I know you don't do laundry. We do have laundry facilities at camp. When we do big bulk laundry, we send that out. but we will have the capacity to wash masks at camp. We're not giving any final definitive, this is how many masks you need to bring, but we can envision and will likely be able to, in high heat or whatever the recommendation is for washing masks, wash masks by OHEL with regular frequency, meaning more than once a week. So we'll follow up with families as we get closer to the summer about how many masks you need to bring. I anticipate that we will require cloth face coverings and not disposables or N95s or anything like that. We hope to stay within also our environmental values here. And I believe the recommendation is just for the cloth face coverings, but we will again continue to keep you updated about what you need to bring to camp in terms of masks.
Well, I'll say this to conclude, and know that we're available by email, phone. Most of you know how to find us at any time of the day or night, which is fantastic. Is we really see ourselves as being in a really an awesome position. And by awesome, I really mean like the amount of trust that you parents put on us as the camp professionals is immense. And we see ourselves as partners in creating a safe and nurturing camp every summer. And one of the reasons why we wanted to begin having these conversations now is so that we really can be partners with you. We can let you know what we're thinking right now. You've given us feedback both here on the call, in emails, and we hope that you'll continue doing that. For the people on our short-term planning committee, I've definitely given us some other things for us to think about and to plan. And we really hope that this will be an iterative process over the next 5 or 6 months. And that you also, if you have expertise or other people or see things that other camps are putting out there, that you really will share them with us. Because at the end of the day, there were a handful of camps that operated safely in 2020. There were some camps that operated not safely at all. And in 2020, some of them got shut down. And most of the Jewish camps that we're aware of are planning on reopening in 2021. And really that we're really on this journey together. So thank you for all of your questions, for your feedback. Please continue to make comments. I will say, we're in a pretty fantastic place when it comes to recruitment. Many of our 2020 campers have already re-registered for 2021. We are hoping to register another 80 to 90-ish campers before the summer begins. And we have some upcoming info sessions over the next few days, over the next 2 weeks, that hopefully saw on either Facebook or email. But definitely, if you know families who are interested in learning more about camp, it is a good time now to tell them. In 4 to 6 weeks, which will put us probably before the end of the calendar year, maybe very early January, we will be hosting another town hall like this. We also hope to publicly put out our next version. The reason why we actually kept the version in Google Docs is we've already changed it twice since it went up publicly last week. So at any point, you kind of see what our latest and greatest our ideas are right there. And as Dr. Marcus kind of stole my thunder, we are super duper excited about running camp in 2021. Truly, everything that I, as a layperson, have seen, the outdoors is one of the best places to be during COVID, and to really reduce the risk of transmission. And the reality is, we run a camp in the outdoors, and a lot of camps are just beginning to talk about tents. So what would it look like? Can you actually run pulote under circus tents? Can kids actually live in in drafty tents? And the answer is, how do you not live? How do you not live like that? So thank you to everybody that took the time to join us now, whether you're sending kids to camp, whether you are part of our staff and planning to work with us this summer, or have worked with us in the previous summer, and especially to our board members and short-term planning committee members who have taken the time out to be with us. So thank you. Email, call, make comments, and we'll move forward from here. Lila Tov.